Hi, I'm Dr. Neil Kingstone from Orillia Eyewear and Eye Care. You know when you go to the eye doctor and we do this test where we blow a puff of air on your eyes or we put some orange eye drops in your eyes, what we're doing is we're checking your eye pressure. And why would we do that? Well, we're screening for an eye disease that you probably heard of called glaucoma. And what is glaucoma? Well, it's a disease where our eye pressures, for reasons that they don't really understand, get too high. And what that does is that puts direct pressure on our optic nerves in our eyes. And our optic nerves are where our blind spots are. So when we drive a car, we've got these blind spots. And imagine if these nerves, which corresponds to our blind spots, become diseased because our eye pressure is too high, they get bigger. And it affects our peripheral vision, becomes worse and worse and worse. So it's known as kind of a silent eye disease because there's really no pain, symptoms. Your eye pressure could be high, dangerously high, and you don't feel any pain. So who's at risk for glaucoma? Well, age is a risk factor, like with many things. As we get older, the risks become higher. In fact, people who are over 60 years of age have 6 times higher risk of developing glaucoma. Family history is a big one. If somebody in your family has or has had glaucoma, a parent, a grandparent, especially on your mother's side, that's a risk factor. People from Hispanic countries or from Hispanic descent, African Americans, Native Aboriginal Canadians are particularly at risk for glaucoma. Previous eye injuries. If you've had an injury, even if it was years ago, let's say you're 10, 12 years old, you've played ice hockey, you get a puck in the eye, it's happened. Years down the road, that person could develop a secondary glaucoma. So it's important to know these things so that we can do the appropriate tests when you come in for your eye test. Also, certain medical conditions like diabetes, hypertension, heart issues, cardiovascular things can sort of increase your risk for developing glaucoma. People who are very nearsighted, got kind of thick eyeglasses because they can't see very well far away, they can be more at risk for developing glaucoma. There's no cure. Right? People who are diagnosed with glaucoma are usually put on eye drops and they stay on them perhaps for the rest of their lives. But it can be well controlled if it's picked up and detected early, and that just minimizes all the issues of people's peripheral vision, called their visual field defects, will be minimized the earlier it's picked up. So I guess the message here is really to make sure that you're coming in for your regular eye checkups every year. It's such a simple test. It's so simple, so quick. Just to screen for glaucoma for anybody, but especially the older you are, the greater risk you are. So thank you for listening. I'm Dr. Neil Kingstone from Orillia Eyewear and Eye Care. Check us out on orilliaeyewear.ca, and thanks for listening. Bye.